Hi there, here are 5 common leukemia myths we are going to debunk today. Myth number 1. Leukemia isn't a type of cancer. Did you ever think leukemia isn't a form of cancer? Well, let's reconsider that. Imagine you believe that a lion wasn't a wild animal. Leukemia is, in fact, a type of cancer. But about 2/3 of people aren't aware of this. It's a bit like thinking the sun isn't a star. Many people believe that leukemia is not a type of cancer because of the word cancer is not in its name. However, it is indeed a form of cancer, as leukemia is a type of blood cancer. It occurs when white blood cells undergo abnormal change, causing them to attack healthy cells instead of fighting off the harmful ones. In simple terms, it's like an internal conflict or friendly fire where the body own cells turn against each other. Leukemia is often referred to as a form of blood cancer, but there's a specific reason why it's commonly called leukemia rather than blood cancer. The leukemia is used to describe a group of cancer that originate in bone marrow and affect the blood-forming tissue of the body. This cancer primarily affects white blood cells, although they can also affect other types of blood cells. Let's move into myth number 2. Leukemia refers to one single thing. Ever thought that leukemia is just one single disease? Well, it's not quite that simple. Imagine thinking all music falls under one category. Leukemia is actually an umbrella term of various types of cancer that affects white blood cells. In reality, there are 4 main types, and each one has its own unique characteristic. It's a bit like assuming that all colors are exact same. Here are different subtypes of leukemia, such as acute lymphoblastic leukemia (ALL), acute myeloid leukemia (AML), chronic lymphocytic leukemia (CLL), and chronic myeloid leukemia (CML), each with its own characteristic and treatment approach. I know it is quite difficult to read these subtypes of leukemia, but I'm quite familiar with acute myeloid leukemia because I am one of the victims in the past. If you are interested about my story, you can go to see my story video. So just move on. So when people refer to leukemia, they are generally talking about this specific type of blood cancer that affect white blood cells. Let's move to our next myth. Myth number 3. Leukemia is only a childhood disease. Thinking leukemia only affects children? Well, leukemia is the most common childhood cancer, but 2/3 of patients are over 65 years old. It's like assuming a book has only one chapter. Myths about leukemia can sometimes lead to misunderstandings and misconceptions. While it's true that some types of leukemia, such as acute lymphoblastic leukemia (ALL), are more common in children, leukemia can affect individuals of all ages, including adults and the elderly. In fact, the incidence of leukemia increases with age, and chronic forms of leukemia like chronic lymphocytic leukemia (CLL) and chronic myeloid leukemia (CML) are often diagnosed in adults. It is essential to recognize that leukemia can impact people of any age group. It is crucial to dispel myths like this one to ensure that people have correct information about leukemia, which can help with early detection, diagnosis, and appropriate treatment. Leukemia is a complex disease with various forms and presentation, and is not limited to specific age group. Myth number 4. Cancer symptoms are always clear. Many people believe that there must be some clear sign if they have cancer. They might expect their body feel uncomfortable or notice some unusual, leading them to seek medical attention. only to discover that they have cancer. However, in reality, is that not all types of cancer show noticeable signs in their early stage. You might actually have cancer without being aware of it, much like the early stage of COVID-19, where many cases show no symptom. In fact, it's surprising 83% of individuals do not suspect they have cancer until it is diagnosed. This is similar to assuming that every cloud in the sky should look dark and threatening before a storm, when in the reality, some storms can approach without any visible warning sign. This myth challenges the mistaken belief that cancer always shows clear signs. Specifically when it comes to leukemia, it is crucial to realize that its early symptoms can be not very strong or not very obvious. Leukemia can start with symptoms like feeling tired, getting sick often, or notice that you have marks on your skin easily. This may not seem serious at first, which may cause people to miss or put off seeing a doctor, making leukemia harder to treat. The main message here is the importance of regular checkup and paying attention to how you feel. Sometimes, even if you don't have very noticeable symptoms, leukemia can be found through simple blood tests when you visit your doctor. So, don't wait for very obvious signs. Catching it earlier is really important for effective treatment, especially with cancer like leukemia. Our last myth, myth number 5. All leukemia patients need immediate treatment. Imagine thinking all disease can be treated the same way, just like some doctors in the 70s and 80s centuries believed using bloodletting or cutting off injured body parts for every minor health issue. Similarly, some may mistakenly assume that all leukemia patients need immediate treatment. This history comparison highlights the importance of customizing leukemia treatment to specific types, because using the wrong treatment for specific illness can lead to more serious problems. It's like thinking a minor cold can cure by bloodletting, which can make a person weaker and less able to fight off the illness, potentially resulting in the death and might have been preventable. Finally, in the case of leukemia, applying an inappropriate treatment can make a condition worse. It's similar to mistakenly believing that cutting off a body part is necessary for a minor wound, when proper wound care could have been enough. Some people might not completely understand the different kinds and stages of leukemia. They might think that all types of leukemia develop quickly and need treatment right away. But it's essential to know that not all leukemia cases are the same. Leukemia is a broad term covering various types, each with its unique trait and behavior. Some types do need quick and aggressive treatment because they grow rapidly, while others are slower and allow for a more careful approach to treatment. The decision to start treatment for leukemia depends on different things like specific type, how far along it is, the person's overall health, and the pros and cons of treatment. Treatment plans are made to fit each person's unique situation. Sometimes, if the leukemia is not spreading quickly or is in its early stages, doctor might choose to monitoring it closely instead of taking immediate action. This is known as watchful waiting. If someone is diagnosed with leukemia, it is important to talk to a hematologist or oncologist who can carefully assess the situation, explain the treatment choices, and make a plan that fits their particular case. It's okay to ask questions and even take a second opinion if needed to make a good choice about their health. In conclusion, leukemia is a cancer of blood and bone marrow with causes that may include genetic factors, environmental exposures, pure cancer treatment, and certain medical conditions. Its symptom varies but can include fatigue, frequent infections, easy bruising and bleeding, pale skin, swollen lymph nodes, bone and joint pain, abdominal discomfort, unexplained weight loss, and fever with night sweat. Importantly, these signs can be similar to other health problems. This highlights how crucial it is to see a healthcare expert if you have these symptoms. Getting checked early and treated is really important when dealing with leukemia. To combat disease effectively, it is crucial to maintain a strong immune system, thinking of your body's immune system as a powerful army. But its strength can be affected by the choice you make in your daily life. Unhealthy habits such as leading to laziness lifestyle, staying up late at night, not getting enough sleep, skipping meals, eating unhealthy food, and avoiding exercise can slowly weaken your immune system over time. Imagine this habit as not giving your children a necessary training, rest, and healthy food. It's like sending your children into battle without proper preparation or supplies. As a result, your immune system becomes less effective at protecting your body from threats like cancer cells and harmful germs. On the other hand, adopting a healthy lifestyle, getting regular exercise, eating nutritional food, getting enough sleep, and maintaining a balanced routine can help ensure your immune system remains strong and well prepared to fight against health problems. Just as a well-trained and well-equipped army stands a better chance of defending its land, a strong immune system is better at protecting your bodies from illness like cancer. In simple terms, the analogy shows how your daily choices and habits can impact the strength of your immune system and consequently your overall health and ability to resist disease like cancer. Before you go, if you found this information valuable, please share these videos with your friends and families. Together, we can debunk myths, raise awareness, and save lives. Remember, you are not alone in this journey. Let's keep unmasking myths and spreading knowledge. Until next time, take care and stay informed.